Trump the Democrat Slayer. TheHill.com. Trump administration seeking to block funding for the CDC, contact tracing, and testing in new relief bill. The Trump administration is attempting to block billions of dollars for contact tracing, additional testing, and other coronavirus mitigation efforts that would potentially be included in Congress's next coronavirus relief package, officials involved in the negotiations told the Washington Post. According to the Post's sources, the administration is also trying to block billions in funding for the CDC that GOP senators want to give the agency as it continues to battle COVID-19 on the front lines. See, again, at first glance, if you're not woke, that sounds scary. Why would you want to stop tasting? But if you know the truth, it's a total fraud that what they're doing to us with the fake numbers, the bloated numbers. Again, a guy died in a motorcycle accident the other day in Orlando. I think it was in Orlando. They were reporting on it. Florida. Died like on scene, bad. Listed as COVID. A couple months ago, the shark bite victim or death. Listed as COVID. Do you really think they're testing a dead body like that for COVID? Absolutely not. The hospitals are writing it down because it is free money. Paid for by you schmucks. And me too. Mama Schmuck too. Schmuckers, both of us. We're part of the Schmuckers company. And the hospitals are eating it up. Why not? All those patients who come and go, we never get paid. All we have to do is write down COVID and it's a free check. $13,000+ easily. Maybe they'll even try to say, well, we put him on a ventilator. The shark bite victim? Yeah. His body's cut in half. Shark got him. We put him on a ventilator. We get $39,000 for that. What about the motorcycle guy? Well, same thing. He was clearly dead on scene. Yeah, I know. And he's been dead for over an hour now since you've gotten him. Well, yeah, but you know. You never know. We can never try to stop saving lives, so we put him on a ventilator. The one specified for COVID use, but whatever. You know. Now, I'm not saying they did that, by the way. But they are, in fact, listing names. Listing COVID on the death certificate of these people who absolutely clearly did not die of COVID. The CDC is as federal as the Federal Reserve. It receives funding in budgets from our Congress to keep itself afloat. It is no more federal than Federal Express, just like the Federal Reserve. Federal Reserve is not a federal agency at all. It is a privately owned organization. Huh. So I'm curious, if I do a little search, who owns the CDC? Centers for Disease Control and Prevention, United States Department of Health and Human Services. Yeah, okay. Is the CDC privately funded? As a private 501c3 public charity, the CDC Foundation receives charitable contributions and philanthropic grants, like Gates and those guys, I bet, from individuals, foundations, corporations, universities, NGOs, of course, that's the deep state, and other organizations to advance the work for the Centers for Disease Control and Prevention. Huh. Now that says that's the www.cdcfoundation.org. But again, if they're taking in money as a public charity to advance the work of the Centers for Disease Control, well, that doesn't make sense. Like, would there be a public charity to advance the Federal Reserve? Again, maybe, because it's privately owned. Is there public 501c3 that help your local county with property taxes to help pay the schools? No. Public-private partnership in CDC, cdc.gov, December 20th, 2019. Partnering with CDC. Ethical considerations for public-private partnerships. CDC works with the private sector because public-private partnerships advance CDC's mission. Can I get an actual answer, though, with absolute certainty? Is the cdc.gov... Well, it says right here, in CDC Foundation, January 9th, 2018, established by Congress as an independent, non-profit organization. The CDC Foundation is the sole entity authorized by Congress. Let's take a look at that. Authorized by Congress to mobilize philanthropic partners and private sector resources to support CDC's critical health protection mission. Again, this is the Gates Foundation, Rockefeller Foundation. The deep state foundations have been authorized specifically by Congress. The CDC Foundation helps the CDC save and improve lives by unleashing the power of collaboration between CDC, philanthropies, corporations, organizations, and individuals to protect the health, safety, and security of America, of course, and the world. Since 1995, the CDC Foundation has launched approximately 1,000 programs and raised over $740 million. The CDC Foundation managed over 300 CDC-led programs in the United States and in more than 130 countries last year. It says here, because CDC is a federal agency, all scientific findings resulting from CDC research are available to the public and open to the broader scientific community for review. Funding the CDC's work provided through the CDC Foundation. So funding is still provided. So right here, funding the CDC's work provided through the CDC Foundation is not contingent on the outcomes of research or other scientific activity being favorable to one or more partners. The CDC Foundation works with CDC to ensure that programs will have a meaningful impact for CDC and public health and complement CDC's priorities and ongoing work. The CDC and CDC Foundation each have review procedures in place to safeguard against possible conflicts of interest. Oh, I bet you do. Why did the CDC change the rules for viruses only for COVID-19? Every other time we've had an outbreak, it says right there in their documents, this is the guidelines, guidance for all medical across the whole country. You must do a test and it must be positive before you put that name down of that disease on a death certificate. What if they're around people who are known to have the virus? If you did not do a test, you cannot put their name down as died from that virus. I showed you guys the document, Zika virus. I already read it to you a million times already. And others very similar. But for corona, they said, no, you don't have to have a test. If you think they have it, that's good enough. And if they've been around people that have it, certainly that's good enough. Write it down. And not only that, we got special funding for you to write it down. Because if you write it down as a hospital, you get paid. Right out of Medicare, Medicaid. It's baked into the cake. They've already passed the law earlier this year. So again, if you're a damn hospital, what are you going to do? What are you going to do? However, again, I guess since it is a federal agency that gets a federal budget, now maybe this is making a little more sense. Trump administration seeking to block funding for CDC, contact tracing, and testing a new relief bill. You know what I say? Go for it. Make America great again, baby.